Hello, everyone, and thank you for tuning in to our IQuit Podcast for Session 2. My name is Jana Weaver. I'm the GPA Healthy Me and More Coordinator and a registered dietitian. Today, I have the pleasure of speaking with Dr. Dale Rakel, a board-certified family physician and our very own GPA Medical Director. How are you, Dr. Rakel? So glad you could join us today.
I'm doing fine, and I'm happy to be here today.
Great, thank you. In this session, we will talk about connecting with others and how getting support from people in your life can make a huge difference when you quit tobacco. We also talk about enlisting the support of your physician and how he can help you reach this goal. Some people don't want to tell their doctor about their tobacco use for concern that the doctor may judge them. What would you say to someone who feels this way?
It may seem that way to some, but in reality, the opposite is true. Expressing a desire to quit shows that you're engaged in your health, and most physicians appreciate and are encouraged by patients who are engaged in their health, and it will prompt them to want to support you. The more your physician knows about you, and the more he or she will be able to help you with whatever your problems are.
I completely agree, and I think this goes for any of your healthcare providers, including your dentist, your chiropractor, and even your dietitian. In your practice, Dr. Rakel, you prioritize building relationships with your patients. In one interview I watched, you encourage people to find a physician they are comfortable with that will talk to them and get to know them. How do you think this plays in with tobacco cessation and long-term success with quitting?
It is of the utmost importance that you find a physician that you're comfortable with. It's only human nature that you will communicate better with people you're comfortable with, and better communication always facilitates better health care, whether with smoking cessation or any other health issue.
Exactly. And as we discussed during the program, the most effective method of quitting is counseling combined with medication. Some individuals may not need medication or even nicotine replacement therapy, but for others, this can be very effective in helping them quit. Can you talk for a minute about medication and maybe some nicotine replacement products and how these can help individuals?
Sure. So the habit of smoking is really multifaceted. Not only when you smoke is there a nicotine high, or some people call it a buzz. There's also the habit of the hand-to-mouth movement, the act of inhaling and exhaling, and just the tactile sensation of having something in your mouth. Nicotine replacement products such as the gum, lozenges, and patches allow you to break these other behaviors associated with smoking while you're trying to taper off of the nicotine. Of course, the ultimate goal is to get off the nicotine. And if you use these products, you must take care to taper off of them and not allow them to substitute for tobacco products. And there are also two products that are prescription that a physician can prescribe you to help you get off of nicotine. These products are bupropion, formerly sold under the brand name of Wellbutrin, and a drug called Chantix. These are not nicotine replacement products, but work to reduce nicotine cravings. They're not for everyone, and you will need to speak with your physician about whether or not they are appropriate for you. The nicotine replacement products are the lozenges and the gum and the patches. They're over the counter and can be bought at the pharmacy. But the two products I just spoke of are prescription and need to be prescribed by a physician.
This is great information, and I would like for us to expand on this a little bit further. In session 4, we go into more detail about exploring different quit methods, and we encourage individuals to choose the quit option that's right for them. We also talk about e-cigarettes, we talk about vaping, and how even though these have been heavily marketed for cessation, that these are not really a safe alternative to smoking cigarettes. Will you talk just a little bit more about using e-cigarettes to quit smoking? And are e-cigarettes as damaging to our health as traditional cigarettes?
Sure. So the problem with vaping or e-cigarette products is that there is just still a lot we don't know about them. And they certainly have not been classified as safe. This is especially true of vaping products that have a taste or fragrance added to them. E-cig vapor contains a chemical called diacetyl, which can harm small airways and cause sort of an asthma-like reaction. Furthermore, the flavored e-cig vapor contains chemicals which could be cancer-causing or cause other health problems. Currently, not enough is known about all of the potential health problems, and the industry, as it currently stands, is under-regulated. I never recommend vaping as a method to quit smoking. Furthermore, vaping sort of simulates the very act of smoking that I previously spoke of. So, in that you still have the hand-to-mouth movement, the inhaling and exhaling, etc. So for a lot of people, it just winds up being a substitute for smoking and not really a way of getting off of nicotine. As I said, I don't recommend vaping as a way to get off tobacco products. However, if you're determined to vape and you're not going to follow my advice, I would tell you to vape always only with the flavorless products and never with the flavored ones.
Yeah, I read some of that research and information, and so this is really good to kind of clear the air about, smoking traditional cigarettes to e-cigarettes to vaping. And so thank you for giving us that information. I know it is confusing for individuals, as the media really paints a different picture for us in regards to using e-cigarettes and vaping for quitting. Thank you for giving us more insight on this, as we know that there's really not enough research, there's not enough known about the long-term effects of using vaping and e-cigarettes and things like that. And, in saying this, we generally, want individuals to find that method of quitting that works for them, but we still want it to be a safe method. We know that there's not a one-size-fits-all, but that's why we want to encourage you, as your medical team, as medical professionals, to really talk with your doctor about the safest and most effective ways to quit and to stay tobacco free. And I do want to point out, while we're discussing this information, that if individuals are interested in those prescription medications that Dr. Regal mentioned, or even questions about nicotine replacement therapy and whether those are covered on your medical plan, you can reach out to our GP member services before you go to your doctor, and you can find out exactly what is covered. And so, just to kind of finish up our discussion with a few other questions, I wanted to ask you, Dr. Regal, what methods in your practice have you seen that are most effective with helping patients quit tobacco?
Well, as you stated a few minutes ago, there's really not a one-size-fits-all approach. But I do think the most important thing to be successful in smoking cessation is to simply stay focused on why you want to quit, and focus on all of the health benefits you will receive by stopping smoking. I find that the patients who just keep that in mind and keep that in front of them wind up being the most successful.
And that is so true. And sometimes, health benefits are a big reason on turning their health around for people to quit, but also for many people, family is a big reason for quitting. And many of them, I've heard people say this as I worked with individuals in coaching and just different aspects, and they say, I want to be around long enough to be a part of my grandchildren's lives. I want to be, a better influence to my family and those around me. So throughout the program, we talk about, the benefits of quitting, like you've discussed, and for your health, and then we talk about the harms of tobacco. We know, and research shows, that quitting tobacco, no matter how long you've been using it, is one of the best things that an individual can do for their health. And we also know that for smokers, it's something that they can do as a benefit to the health of their loved ones who are exposed to that secondhand smoke. And this is something we haven't really talked much about, but can you touch on for just a second the impact of secondhand smoke on children and on other people around?
Well, smoke have have increased incidence of asthma, respiratory infections, and ear infections. And in infants, there's also an increased incidence of sudden infant death syndrome. And as far as the overall effects of smoking, all the effects that smoking has on you, which are increased chance of lung cancer, heart disease, emphysema, so on and so forth, all these things are transferred to all the people around you. So people exposed to secondhand smoke have a long-term increased incidence of heart disease, lung cancer, and emphysema. And so by quitting smoking, you will not only help your health, but you'll help the health of the people around you.
And that's a big deal, right?
That is.
It really is a big deal. And so I want to just, encourage individuals that, we're going to give you more information on some of these things we've talked about as you go through the program. And I'm even going to talk a little bit about nutrition, and give some information on, eating healthy while quitting. And we know that tobacco use does affect nutrition. It can affect, your taste buds and kind of things like that. It can also affect the body's ability to absorb, and process those vitamins and minerals and nutrients. In terms of, nutritional deficiencies or, other significant health impacts related to tobacco use, what do you typically see most often?
Well, for one thing, vitamin C, which the body needs to prevent organ damage, is depleted when nicotine is present. People who smoke also tend to have a higher incidence of osteoporosis because of there's less vitamin D absorption, and this leads to less calcium available to strengthen the bones. Nicotine also suppresses a person's appetite by interacting with the brain and the central nervous system. One of the ways it decreases your appetite is it simply decreases the way you detect flavor, and it decreases the flavor of food, which actually reduces your enjoyment of food. Quitting smoking will help restore the body to a better nutritional status. Until a person is able to stop smoking completely, it is a good idea to add a multivitamin supplement and also to eat more fruits and vegetables. This will help the body by making more minerals and vitamins available to be absorbed.
I love hearing you talk about eating more fruits and vegetables. You're speaking my language now, Dr. Regal. So just a couple of things to kind of wrap up our session. I know we highlight the immediate and the long-term health benefits, and we've just talked, kind of about that throughout, and how, no matter, when you quit, that this can add years to your life. And I just want to finish by asking you, in your opinion, what are some of the biggest health benefits to quitting, no matter, like we said, how long you've been smoking or using tobacco?
Well, no matter how long you've been smoking, quitting will almost immediately lower your blood pressure, and it will reduce your risk of heart attack, stroke, and also reduce your risk of developing lung cancer. Furthermore, almost immediately, you'll find you have more energy and less respiratory infections. So, not only do you have long-term effects, but you'll have some pretty immediate effects, and just increased energy. You'll find you're sick less, and then you may not see this or feel this, but an immediate health benefit is your blood pressure will lower in most people.
That's great. And one more last question. I was just thinking about this. A lot of research shows that people try to quit tobacco multiple times. And is there any advice that you would offer on successful quitting in regards to relapse prevention? Do you think it's okay for, ex-smokers or tobacco users to still have, a cigarette or maybe a dip every now and then? What is your opinion on that?
Well, nicotine is a highly addictive substance. It's as addictive as cocaine in some people. So every time you have a cigarette or take a dip or have a cigar or whatever, you are dangerously setting yourself up for a relapse, just like with any other drug. So I would say total abstinence is essential for long-term success. Absolutely.
Awesome. Well, Thank you so much, Dr. Regal. This has been so informative. And to wrap things up, I would just like to encourage everyone to take some time this week to ask for support by reaching out to your friends, your family, and setting up that appointment with your doctor. Your support system can play a big role in helping you quit. Write out your goals and take some time to prepare for your quit day. Use the resources we provided, or feel free to reach out to us as well if you have specific questions. You can email us anytime at wellness@gpatpa.com. Thanks again for joining us today.